Right.
For example, Rorschach, CAT, or MMPI, RF, like that.
Mm.
We can administer some cognitive tests also. Even we can administer some of the tests that can measure
Mm.
the speech pattern. So, so this is our traditional take. And when we are applying machine learning or AI technology, specifically for the mental health diagnosis, then what will be our strategy? I think now it is visible to you.
Yes, sir, it is visible.
Mental health disorders are among the most pressing global health challenges, yet their diagnosis remains complex due to subjective symptoms and variability in individual presentation. In the last class, I have told you that there are symptoms for the different mental health disorder and the symptoms are overlapping. Therefore, differential diagnosis is important. And the traditional diagnostic methods rely on clinical interview, self-reported questionnaire, and structured diagnostic criteria like DSM-5, ICD-11, etc. However, machine learning is transforming this field, providing data-driven, objective, and efficient methods for diagnosing mental health conditions. ML enables early detection, improves diagnostic accuracy, and personalizes treatment strategies. Now, if you want to find out the any sort of mental health disorder among the school children or the college students, then you can apply this model. Role of machine learning in mental health diagnosis. Machine learning models analyze large data sets to detect patterns that may not be easily recognizable by human experts. These models can be trained on various types of data, including electronic health records, speech and text analysis, neuroimaging, and physiological signals. The key application of ML in mental health diagnosis include. So now you imagine a lab situation where there is one specifically designed chair responding. And at that time, the neuroimaging and the physiological signals, they are also collected. Okay, now imagine this situation. Usually, you will find this type of situation in case of forensic psychological assessment. I have seen this type of lab in National Forensic Science University. The key applications of ML in mental health diagnosis include number one, predictive analysis and early detection. Early diagnosis is crucial for effective intervention in mental health disorders. ML algorithms can analyze patient history, genetic predisposition, and behavioral data to predict the likelihood of developing disorders such as depression, anxiety, schizophrenia, or bipolar. For example, deep learning models trained on social media posts, voice recording, or wearable device data can detect early signs of mental distress. Now you will find that if people are wearing the smartwatch, and the smartwatch is recording your heartbeat, your pulse rate, all those things. And you are making different posts in the social media. And by using the deep learning, it becomes possible to predict, that is, whether the selected candidate has any depressive disorder or suicidal ideas or not. Number two, natural language processing in psychiatry. Natural language processing, a branch of AI, is used to analyze spoken and written language patterns. Patients with depression or schizophrenia often exhibit unique linguistic markers, such as reduced sentence complexity, negative sentiment, or disorganized speech. There is a concept that is called the sentiment analysis. By using the sentiment analysis, one can identify, that is, whether the individual possesses negative affectivity or positive affectivity. Even if you can study the speech pattern, then by using the NLP technique and the deep learning technique, you can predict, that is, whether the candidate is suffering from any depressive disorder or not. Number three, Vishal, this is clear to you?
Yes, sir.
Hello,
This is
Vishal.
clear.
Yeah,
Yes,
okay.
yes.
Number three is neuroimaging and biomarker identification. Functional MRI, that is fMRI, electroencephalography, EEG, and other neuroimaging techniques provide valuable insights into brain activity patterns associated with mental disorders. Machine learning models can analyze these complex data points to differentiate between individuals with and without psychiatric condition. For example, AI models have been used to detect schizophrenia by identifying distinct brain connectivity patterns. It has been observed that there is some disorders in the brain function among the schizophrenic patients. Therefore, by using the fMRI, one can predict the probability for schizophrenia. Number four, wearable technology. Wearable technology and physiological monitoring. Smart watches and fitness trackers collect real-time physiological data such as heart rate variability, sleep patterns, and activity levels. Machine learning algorithms analyze these biomarkers to assess mental health status. Changes in sleep pattern, for instance, can indicate depression or bipolar disorder, while abnormal heart rate variability may be associated with anxiety disorder. Okay, so specific type of heart rate variability, specific type of sleep patterns, specific type of activity levels that is there. Okay, so we have to study those things. Personalized treatment and therapy recommendations. Machine learning can also assist in personalizing treatment plans by analyzing individual responses to different therapeutic interventions. By integrating data from past treatments, genetic information, and patient preferences, machine learning models can suggest the most effective therapy or medication, reducing the trial and error approach often seen in psychiatry. So, the psychiatrist or the clinical psychologist or the psychologist or the consultant, they will collect the data through the Google form or any other form. And they will feed this data to the AI. And after that, AI can give you the diagnostic areas or AI can suggest you that please you check this type of complaints are there or not. Number one. Number two, AI can give you the specific suggestion, that is whether the behavior therapy or cognitive behavior therapy or any other therapy which will be applicable for this type of complaints. Advantages of machine learning in mental health diagnosis. Improved accuracy. Machine learning models can analyze large data sets and identify subtle patterns that human clinicians might overlook. Early detection. Predictive models help in identifying at-risk individuals before symptoms become severe. Reduce stigma. AI-based mental health tools such as chatbot and self-assessment applications provide anonymous and accessible screening options, encouraging more people to seek help. Scalability. Machine learning can support mental health diagnosis at a large scale, addressing the shortage of mental health professionals in many regions. Here I can tell you that is there is one multivariate statistics, which is called the discriminant function analysis. By using the discriminant function analysis, that algorithm, machine learning can predict that is whether the individual discriminant function is matched with the specific type of diseases or not. Challenges and ethical considerations. Despite its potential, machine learning in mental health diagnosis faces several challenges. For example, data privacy and security. Mental health data is highly sensitive and ensuring patient confidentiality is critical. Bias in AI models. ML algorithms may inherit biases from training data, leading to inaccurate diagnosis for underrepresented populations. Therefore, this is my suggestion. When you want to use the machine learning, at least you have to collect a large number of data. So your training data, if the training data is not very good, then whatever the discriminant function machine learning will do, that may be biased. Lack of explainability. Many AI models function as black boxes, making it difficult to interpret their decision-making process. Regulatory and ethical issues. The integration of AI in mental health care requires regulatory framework to ensure ethical deployment and avoid potential use. Conclusion. Machine learning is revolutionizing mental health diagnosis by enabling early detection, improving diagnostic accuracy, and personalizing treatment. However, the ethical and practical challenges must be carefully managed to ensure responsible implementation. As research in AI and psychiatry progresses, ML has the potential to bridge the gap in mental health care and provide accessible, efficient, and unbiased diagnostic service. And after that, there will be some self-practice. I have given some of the statements there. You will judge whether it is false or it is true and what is the justification. Dear students, I clear to all of you. So, machine learning, very important role in mental health diagnosis. In diagnosis, machine learning follows the data from the training data. Whatever the training data are there, so machine learning follows them. Therefore, be careful for the training data. If the training data is biased, then the information provided by ML, that possibilities, some biasness possibilities there. So be careful about it. Okay. So for predictive analysis, early detection, machine learning will help you. Machine learning follows the natural language processing. Therefore, machine learning provides you the diagnosis category or personalized training program just as a spoken language. And machine learning depends upon the biomarker identification, neuroimaging, also the physiological monitoring through the wearable technology, and machine learning provides you different personalized treatment and therapy recommendation. It has lot of the advantages like improved accuracy, early detection, reduced stigma, and scalability. Again, like all other symptoms, all other systems, machine learning has also some challenges and ethical considerations. So be careful about it. Okay, thank you, students. I think there is no question.
Thank you, sir. I have one question. Um,
Okay.
one doubt. Uh, Regarding the ML models functioning as black boxes, just to confirm if my understanding is right on that, it means that ML models, uh, their decision-making process is not visible to us. So we are not sure how they are reaching to the conclusions, to the diagnosis, probably. And if there is any bias coming up, uh, or if there is any wrong diagnosis coming up, we might not have visibility specifically how the model is reaching to that conclusion. Would I be right in saying that, sir?
Yeah, AI has followed the machine learning techniques, machine learning algorithms, and machine learning is based upon separate data warehouse. And if the data is biased, then there is a high possibility for developing the pattern out of which machine learning can give the information to AI that this is the correct procedure or this is the incorrect procedure. So largely depends upon the whatever the data are available in the uh, good journal specifically. Therefore, they are giving priority on those areas. There is a chance for type 1 and type 2 error. No?
Yes, sir. Exactly.
That is also there. Therefore, interpretation of the AI data depends upon the high level of competency of the researcher or the interview. Good knowledge you should have.
Mhm.
Okay.
Okay, sir.
Okay. Thank you for joining. Thank you, Vishal. I hope other students will follow the class later on from the
Yes.
YouTube.